You're about to learn some very effective techniques to release your hip flexors. But first, let me share a few symptoms that the hip flexor can produce. So if your hip flexor is tight, it will pull on your low back and create low back pain. If you touched your low back right now, does it feel tight? If so, it's probably because your hip flexor is pulling on the front of your spine, pulling the spine forward and down, and not only creating an exaggerated low back curve, but also that tension in the spine because the low back muscles are trying to pull the spine back into place. Now also what this will produce is a protruding belly. So it's not that you need to lose weight because your low belly is sticking out. It's you need to release and lengthen your hip flexors, your psoas muscles, so that your organs in that area, your reproductive and your digestive organs, are no longer being pushed forward. Now another set of symptoms here are restriction in the hip socket and in the groin. If it's hard for you to take a big step, it restricts your hip and maybe pinches the hip. It's again because your hip flexors are short and tight. Another one is deep pelvic pain or even menstrual issues because the psoas can restrict blood flow and nerve impulses into that area and throw off your cycle. If one side of your psoas muscles are tighter, then it will twist your pelvis to that side. Another big one is chronic constipation. If you have that or have been battling with that, release the hip flexors, use these techniques, and you may just feel a big relief there. Because think about it, if your hip flexor muscles are pushing on your intestines or again restrict blood flow into the colon and the intestines, that will certainly give you a hard time having a good bowel movement. Another one that is seemingly unrelated is difficulty with breathing. We always blame our breathing problems on stress, but sometimes it really has a physiological reason, like the hip flexors pulling on a ligament that it shares with the diaphragm and nerves that it shares with the diaphragm, so that it pulls the diaphragm out of place a little bit and just enough to make it irritated and no longer be able to contract and expand easily when you breathe. So the following techniques are very, very valuable and may just put not only your low back but your entire system back in balance.